We have always been fighting this battle on two fronts. We have always been fighting it on the health front and on the economic front. Both of those issues have been considered equally as we've dealt with this issue from very early on. And that continues to be our focus, as that will be into the future. We are getting, obviously, good news on the health front. Yesterday, with just 4 cases, a rate of growth of 0.22%. Those sorts of figures were unimaginable weeks ago, and they are being achieved now because of the patience and discipline and efforts of the Australian people right across the country. And we thank you again for your patience and the way you are going about your lives each and every day as Australians. It's a credit to you and it's a credit to our country in this difficult time. Tomorrow I'll be providing you an update with the Chief Medical Officer on the effective rate of transmission figures that I first raised with the Chief Medical Officer a week ago. This modelling work, which is being updated on a weekly basis, will give you a further indication of how we're travelling this first week down into that 4-week process that the National Cabinet flagged as being the period of time in which we'll be assessing our performance and looking at how we can start easing restrictions in that 4-week period. So we're 1 week down almost, and we're making good progress, and we can report further to you on that tomorrow. That also involves making good progress on things like testing kits, personal protective equipment, respirator supplies. The status of those and the supply lines are in place, and they're strong, and that's enabling us, I think, to make a lot of progress. We are on the road back, and that is demonstrated by the measures that we've already taken. And we're on the way back to a COVID-safe economy as well, which is what we have to achieve. We are building the protections for this COVID-safe economy in the areas that I've mentioned, importantly in the area of surveillance, I should say sentinel testing, in the area of industrialising our contact tracing capabilities and our immediate response capability to outbreaks wherever they may present themselves. We have moved on elective surgery. States are moving on schools, and I welcome that very much. The schools changes are a very important step in how we reopen our economy going forward, and most importantly to ensure children are getting the best possible education. And we are, in 3 weeks, as I said, will be moving on those baseline restrictions after considering that further information from the health advisors, and states also are already moving where they've gone beyond the baseline restrictions in scaling that back already, and we expect to see more of that in the weeks ahead. But let's not get complacent while our numbers are good. One number that is never good is the fact that 75 Australians have passed away. And as sad as that is for those families, let's not forget that in countries that are smaller than Australia, like Belgium, 6,262 people have died. In the Netherlands, 4,068 people have died. In Sweden, 1,937 people have died. If you look at the fatality rates as a proportion of population, in the United States, it's almost 50 times higher than Australia. In France, it's over 100 times higher than Australia. In the United Kingdom also, just under 100 times higher. In Germany, it's over 20 times higher. In Switzerland, it's over 60 times higher. Denmark, over 20. Norway, 12. These are all sophisticated, developed economies with good health systems. This can happen in Australia if we're not careful, and that's why Australians and our governments have been so careful to balance the needs to get our economy back to a COVID-safe level so it can support people's incomes and we can return to higher rates of growth into the future. Now, in terms of getting our programs in